Good afternoon. I'm Arifa Parker. I'm a specialist physician and infectious diseases specialist who has actively been involved in our COVID-19 response from way back in January 2020, from the time we started screening travelers and preparing our hospitals for this COVID-19 response. So it's been a long 21 months for me, all-consuming. Also, I was fortunate to get my vaccine in February of this year. I also remember feeling, wondering whether, a bit skeptical because we were part of the Johnson & Johnson / Sisonke trial. But I did my research, and I'm glad that I went ahead and took my vaccination. So for me, the second wave was absolutely devastating. In addition to the patients lost, I lost colleagues, family, and friends. The third wave, however, was a bit different, almost senseless. It was even more sad and heartbreaking, as a lot of these severe infections and deaths that we saw were preventable, entirely preventable. What was striking in the third wave was that my colleagues were not dying or getting admitted, as most of us were vaccinated and had mild disease when we had COVID. Family who were vaccinated ended up getting very mild disease, and sadly, those who died had delayed their vaccinations for various reasons, their vaccination appointments. Severe COVID and death from COVID is entirely preventable by vaccination. Evidence from privileged countries who had vaccination rollouts long before we were able to have demonstrated that vaccination can do the following 4 things. It reduces transmission. It effectively prevents severe COVID and hospitalization. It effectively prevents death due to COVID. And also emerging evidence shows that the vaccination reduces episodes of long COVID, so we can prevent disability due to COVID and COVID-related lung disease. So this international evidence mirrors my experience from the third wave. In my rounds done at Tygerberg and also some of my outreach rounds done at the Brackengate Field Hospital, I found that 99% of the patients that I saw were not vaccinated. There were a handful of patients who were vaccinated, and these patients tended to have milder disease, minimal infiltrates, and we were able to discharge those patients much quicker. So please, my advice as a frontline physician and infectious diseases specialist is for you to take the vaccine. I don't work for pharmaceutical companies, and I have nothing to gain by urging you to vaccinate, except to save lives and prevent disabilities from this devastating infection. There is robust evidence that the vaccine is entirely safe, so take it for you and take it for those around you. We have seen far too many families ravaged by this infection, children left without parents, multiple members of the same family dying within days of each other, or as we've seen, even on the same day, pregnant women dying within days of giving birth. All of this is now vaccine preventable. This vaccine means meals with families, joyous Christmases, Eids, Hanukkahs, and Diwalis and other religious gatherings. It means celebrating weddings and, yes, dignified funerals. It means sport matches, opening up the economy, and praying in congregation. Very recently, I had a family meal with my grandmother and some family for the first time in months. And it was wonderful knowing that if that event was going to be a super spreader event, that everyone would have mild infections. No one would die because everyone present was vaccinated. The COVID vaccine works. It is safe. It saves lives. Severe disease and death in the upcoming fourth wave is entirely preventable with this simple intervention. My message to the public is to please make the right choice in solidarity with us and choose to take the COVID vaccine, not tomorrow, not next week, not next month. Please, please, I urge you to go and vaccinate today. Thank you.